Okay. So I just wanted to ask about, is it very, like, is being an anesthesiologist, are you on call mostly, or are there specialties where you cannot be on call as an anesthesiologist?
So let me go back. As far as call schedule for anesthesiologists, you really, it depends on okay, so you'll start off like your day typical. Let's start off with a typical day of an anesthesiologist. You would start actually, let's do it for a resident. We would start like around, I would be up by 3 a.m., 3:30 a.m. You have to be at the hospital by 4 because you have to have your room prepped. They'll give you, you'll have like your attendings. They'll give you your room that you're responsible for, and you're in charge for all cases that come through that room. So you go, you make sure all your equipment is there, everything is prepped. You got to get your drugs out, make sure you have all your medications. And of course, we have lectures. So at sometimes you may have to go sit in on a lecture at around 5 a.m. Everybody has to be there because your cases start at 6 a.m. You also have to make sure your machines are checked, make sure everything is ready to go, because when you're intubating a patient, you want to make sure you have all your emergency medications on hand. You have to have all your equipment, make sure everything is functioning, because the last thing you want to do is have somebody's airway closed off and you don't have all the equipment to gain access again. You can cause a lot of problems afterward.
Right.
And you don't want to hold the surgeons up either for their cases. So that's like the typical day. Throughout the day, you're getting all your cases. They're going. You could have an emergency case where you may have to stay back till 11, midnight, 1 in the morning. It doesn't matter. That's because all the cases in that room you are responsible for. Now, calls, the way they work is usually you'll have different call days. On anesthesia, we would, well, in the program that we were in, that I was in, we would have call, I think it was, I want to say Q3. So every 3 days you would take call, and also responsible for 1 day of every other weekend. You would take call at that time. So what that means is you're not really in a case in the OR. You're just zooming around the hospital, and you're just you're pretty much close to the ICUs, and you stick for the emergency room and ICUs, emergency room, and pretty much that's it for your trauma base. Because if you're needed for, and codes, you're running codes. So anytime there's any codes around the hospital on the surgical floors, you have to be there. So that's typically what your call. So you're not like confined to one room, because in anesthesiology, you have one patient, and that's your patient all the way until the case is over. So being on call, you won't be able to handle that case and everything else that's going on in the hospital.
I see. So. Oh, okay. It's a lot.
Yeah, it's pretty busy.
Sounds so intense. Okay.
Yeah.
So the next question we have, this is a very vague question, but
okay.
Take a stab at it, see what we get. So, is one doctor more important than another in the context of a hospital setting?
So in a hospital setting, I would like to say each one is equally important. Okay. And not just doctors, the nurses included, everybody that's on staff, the researchers, everyone has an equal part to play in a healthcare system and how everything functions, such as a surgeon who's working, they can't control what's going on behind the curtains. So you need the anesthesiologist. After that case is over, I want to go home. I can't manage those patients when they're on the floor, or if they have to go to the ICU. I mean, I can, but generally I won't be able to be that one who's doing it. Usually your internal medicine, or sometimes if whoever's running the ICU, they're the ones who's necessary for that. And then you have the outpatient setting, like you will need your, the surgeon, whoever did the case. Of course, they have to continue with that. You also need them to follow up with their primary care to address other comorbidities other patients may, present with that I can't deal with. So I mean, and even let's go down to the emergency room. I don't have the time to sit there and to, do an emergency case unless I'm supposed to be there. It's everybody has their part to play and their role in healthcare. The nurses are very, very important. They're the ones who's watching your patients because, I may have that's because, prior to anesthesiology, if you're on the floor, you may have, 10, 20, 30 patients. I can't, and they're all over the hospital, mind you. So, we may have to cross the street in Gainesville, the way the hospital is situated, you'd have to cross the street, go back over. You have patients on all different floors. I can't keep track of all of that.
Yeah.
So your nurses are very vital. They're watching the patients. You call down to their floor. Hey, how's my patient doing? They give you all the information. They put in all the labs and everything that got there. If you need labs, you call them. They make sure that they get that for you so you can see what's going on. Radiology, those are another subset of doctors. You cannot get by without them. Pathology, these are the physicians that you don't see. That's very essential to healthcare. Pathology is one of those things where they call them a physician's physician. So, without these different diagnostic physicians and other ones who are managing the floors, I mean, you can't get by. So healthcare on a whole is a team approach. Although some people might try to believe that one is more important than the other, it's really not. Everybody, every patient is touched by many different physicians when they come through those doors.
Right.